There's a really common assumption that if something's labeled natural, it's probably safer than a pharmaceutical drug. I wouldn't say I completely bought into that, but I also never really challenged it. Natural products just feel safer, they feel less risky. They're sold in everyday stores and they don't have those scary warning labels that prescription medications have. Their packaging is calm and earthy with plants on it like you'd see in your garden. But after learning about truthiness versus truthfulness in this course, I started thinking more carefully about that instinct, where it comes from, and if it's actually based in evidence. The association between natural and safe is reinforced constantly. Wellness marketing emphasizes purity and avoiding chemicals. Social media promotes plant-based remedies as gentler alternatives to conventional medicine. There's also a broader cultural skepticism towards pharmaceutical companies, which can make natural products seem more trustworthy and inviting to take in comparison. But over time, those cues can shape perception. The word natural starts to function as a reassurance signal. For me, the interesting part was realizing that my sense of safety wasn't based on regulatory standards or clinical trial data. It was based on accessibility, presentation, and cultural messaging. That's what truthiness captures. When something feels accurate because of how it's framed rather than if it's actually accurate and based in reality. However, when you look at the legal framework in Canada, that distinction becomes a whole lot clearer. Natural health products are regulated by Health Canada under the Natural Health Products Regulations. Prescription drugs, on the other hand, are regulated under the Food and Drugs Act, and the Food and Drugs Act requires a lot more extensive pre-market clinical trial evidence before being approved and available to the public. That difference emphasizes a regulatory structure. It shapes what kinds of evidence are required before products can reach the market and the consumer. There are also documented interaction risks that aren't obvious from packaging. For example, St. John's wort. St. John's wort is a widely used herbal supplement used to treat depression and anxiety. However, a 2017 review by the American Family Physician revealed its strong interactions and reduction of efficacy for drugs like antidepressants, SSRIs, and oral contraceptives. While that doesn't mean that St. John's wort is inherently dangerous and should never be used, it does highlight that availability and labeling don't necessarily communicate interaction risk. You may see that it can promote a positive mood while being on birth control and having no idea that it could potentially affect the effectiveness of the drug that you're taking. There's also been research done by the New England Journal of Medicine that has raised concerns about gaps in post-market safety monitoring for dietary supplements compared to prescription drugs, which are constantly being monitored. The picture that emerges isn't that natural products are unsafe. It's that the word natural isn't a scientific classification term. It's a regulatory and marketing category. This becomes particularly important in clinical settings. If someone assumes a supplement is harmless because it's natural, they may not disclose it to their doctor. That can complicate medication management and raise potential issues about informed consent and standard of care obligations. What changed for me through this reflection was realizing just how much my perception of safety was shaped by framing and accessibility rather than regulatory detail. These green labels feel reassuring, but that reassurance isn't necessarily tied to equivalent evidentiary standards. Understanding truthiness versus truthfulness helped me see how marketing, cultural narratives, and regulatory law interact in shaping health decisions. Now, when I see the word natural, I don't automatically assume it to be safer. I see it as a category that deserves a closer look and is to be used to supplement traditional medicine, not take the place of it.